and welcome to another education podcast. My name is Demi, I'm a speech and language therapist.
My name is Julie, I'm a dietetic speech and language assistant on Oval Ward.
So today we wanted to run through about the 4QT, what it is and what it does, and also run through the swallow screen. And finally, how to refer to speech and language therapy, when it might be indicated and when it might not be. So the 4QT stands for the 4-question test. It's a question-based tool and it's designed to identify patients who might have a swallowing problem. It's also designed to be used by all staff. So according to a 2020 pilot study, the 4QT has been shown to be highly sensitive in identifying older, frail adults with potential swallowing problems. It aims to empower healthcare professionals to look for swallowing difficulties before referring to a speech and language therapy team, and this potentially improves the quality of life for dysphagia patients. So Julie, who are we using the 4QT for?
So we use it for our patients who are aged 65 and above or have a frailty clinical score of 5 or above.
Okay. And how quickly should this be done upon admission?
So this should be done within 4 hours of their admission.
Perfect. Is there anything else we should know?
Yeah, so obviously we encourage people to use our own clinical judgment to decide who requires a 4QT or a swallow screen.
So Julie, I'm going to ask you a few questions as part of the 4QT just to see if there might be an indication of a swallowing problem. So the first question, Julie, do you ever cough and choke when you eat and drink? Okay, no problem. What about, does it take you longer to eat your meals than it used to?
Yes.
Okay.
Can do.
Okay, good to know. Have you changed the type of food that you eat?
No, I still like the normal food.
Still like normal food, no problem. And does your voice change after eating and drinking?
Yeah, it can sometimes sound a bit wet.
Okay, like you're talking through water?
Yeah.
Okay, that's helpful to know, thank you Julie. So I think what we might do then is complete a swallow screen for you. So Julie answered yes to 2 out of 4 of the 4QT questions, so I'm going to proceed with the swallow screen. So I need to make sure that Julie is sat upright and is fully conscious, which she is. Julie, can you cough on command for me? Good. Julie can cough on command. Julie, can you phonate clearly? Can you say ah? Clear voice, good. And you're able to sit upright and maintain that position throughout the screen, so that's another check. So the first thing as part of the water-based test is to give 5 teaspoons of water. Julie can do this herself, so Julie can do that, that's fine. She doesn't need assistance, but with most of your patients, they might have some coordination problems or have confusion, and they might need a little bit of assistance with that, so you could provide the teaspoons for them. In this case, Julie, can you have 5 teaspoons of water, please, and swallow after each one? You have a bit of a break to swallow after each one.
Okay.
Perfect. So I'm looking for any signs of aspiration during this, any signs of coughing, any throat clearing. Haven't had any of that yet. As part of the swallow screen, I'm also just having a look at any hyolaryngeal movement, so sort of where the Adam's apple is, to see if there's any movement, to see that the swallow has been initiated. Good. No signs of aspiration there for you, Julie. So the next step is to have a sip from an open cup. Open cup, just one small sip, please. Big cough, Julie. Good airway protection, that reflexive cough, that was a big strong cough. So that might have been a sign of aspiration, it might have gone down the wrong way. So in this case, Julie has failed the swallow screen and a referral to speech and language therapy might be indicated. Just for the sake of completing the swallow screen, can you now drink freely from the open cup, Julie?
Sorry.
Signs of aspiration are still going on. Perfect. Okay, so although because of those signs I would still refer to speech and language therapy, it's important that when you do refer, you refer with as much information as possible so that we can appropriately triage the patients. And that's the swallow screen. If the swallow screen was passed and there was no overt signs of aspiration, no wet voice, no coughing, no throat clearing, a speech and language therapy referral isn't really indicated. But again, use your clinical judgment, observe your patient at meal times, during eating and drinking, and observe it for any difficulties, because a referral might still be indicated, but again, use your clinical judgment. So a formal step-by-step PDF guide on how to complete the swallow screen can be found on AlexNet, and it's named Dysphagia Screening Tool. Julie, what do we do if a patient displays signs of aspiration during the swallow screen? So any coughing, throat clearing or wet voice?
So then we need to do a referral to the speech and language therapy team so they can do a formal bedside swallow assessment.
So a formal bedside swallow assessment will be completed by a speech and language therapist. It involves a few things. They will do an oromotor exam first. They will then use oral trials and, if needed, test the patient on a few different consistencies from the IDSI framework, whether that be diet or fluid modification or both. And then they will create a plan and put a sign up, and the speech therapist will decide whether an oropharyngeal dysphagia is present or not.
Okay, Demi, so is there any other important considerations we should take?
Yeah, of course. So regular mouth care is super important. We want to make sure that our patient's oral hygiene is kept up to scratch. So you'll find mouth care bits on your ward, so make sure you're using the right size toothbrush. There are these smaller ones as well that we prefer to use sometimes. You can sort of get in there a little bit better. We also have these torches that should be available on the wards. Looking in people's mouths, make sure that there's nothing in there, under the tongue, roof of the mouth. We do also have these mouth care kits. They have pink sponges. These are to be used for moistening the mouth and the lips only, and not to be used for all mouth care. But for more information and more detailed information, there is a separate education podcast specific to mouth care, so please check that out as well. So thank you for watching. Please look out for the next podcast, and if you have any questions about anything that's been said, please reach out to the speech and language therapy department. Thank you.
Thank you.